spinal cord. It's called your brainstem. Every single vital message has to pass through the brainstem on the way to the body. We all know that our neck controls the lower half of our body. Well, what if over the course of our life, we've had physical, chemical, and emotional stressors deposit on our nervous system, like stains of spaghetti on a shirt, that has caused the muscles to pull the spine out of its proper position? Can you see how even small changes in the alignment of this top bone, called the atlas, it's called the atlas after the Greek god that held up the world. This is your world. The thing about the atlas is it's unique. Turn your head. All right? Hopefully it doesn't hurt. Atlas vertebrae is the only level in the spine that does not have a disc above it or below it. That's why enables you to turn your head so much. 60% of the rotation of your head occurs right there. But it comes as a double-edged sword. Because there's no disc above it and below it, it's the easiest vertebrae to misalign over the course of our life. And sometimes it occurs early in life when we're learning to walk, or if we had a traumatic birthing experience, or we were playing sports when we were younger. And sometimes the symptoms don't show up later. 90% of the information that goes from your body to your brain that tells your brain whether or not you're healthy comes from your spine. Small changes in your structure can have profound effects on the function of your body. So an upper cervical specialist has gone through training above and beyond the traditional rack and crack one to be able to obsessively analyze the alignment of the skull, the top bone, and the neck to 1/100th of a degree using a computerized x-ray. And we determined and developed a precise angle to correct the structure, to take pressure off the brainstem, to let the body heal and recuperate. The other thing that we do that's unique is we actually verify our work. We don't just pat you on the back and say, we got it. We actually, after our initial correction, verify our work with a follow-up picture. Most doctors don't do that. That's a hard world to live in, because you know when you get it and you also know when you don't. But that's how I treat my family, that's how I've been treated, and that's the only way that I would care for somebody. I need to know that I know that I know. So it's a little bit of the difference of what we do. What are some of the things you hear about chiropractors? They're quacks. They're bone crackers. They're not scientific. Once you go, you got to go for the rest of your life. I can spend the next 3 days debunking all of those things. And our patients who are here, the members of our practice, can attest that none of that stuff occurs in our office. How many of you have a TV? How many of you have heard about the cervical care before this evening, other than the patients? Channel 2 News, last Monday night, 6 o'clock and 11 o'clock, had a nice piece on the effectiveness of upper cervical. A colleague of ours in Florida was picked up after, they picked up a story after she had a patient that couldn't hear for 15 years regain hearing. She called the news stations. They loved the story so much. You can go on Channel 2's website, type in upper cervical chiropractic, and watch it. It was a beautiful piece. And over the past couple of years, we've been getting the word out. Upper cervical care has been on Good Morning America. There was a big blood pressure study that showed medical doctors, University of Chicago, were able to determine that patients under upper cervical care were having a bigger drop in their blood pressure than patients on 2 drug therapies. A 14 drop in systolic and 8 drop in diastolic. Why? Because it's been a nervous system. And we were recently on The Doctors, and recently on the Montel Williams show. All these things are on YouTube. So we're getting the word out. And I want to take a second to thank the members of our practice who came tonight, because you selflessly came here tonight to bring somebody that you care about into our space to hopefully find them some help. And I love and I appreciate you for that. So let's bring it back to Stephanie as we wrap up here. I remember Pat's phone call to me, the very first phone call. She told me the whole story that I just told you, minus the getting together part. And she said, do you think you can help my daughter? And I said to her, what I still say to every patient, a prospective new person that I meet, I don't know whether or not I can help your daughter. But I do know that in one moment, she was functioning just fine, and then the next moment she was not. And if she has a small misalignment at the top of her neck, and we correct that misalignment to alleviate pressure on her nervous system, then I know she's going to be better. I know, just like these keys will fall to the floor if I drop them, that she's going to heal. And very slowly, she started to regain her health. So here's the opportunity. We came here for two reasons: to motivate you and to educate you. Hopefully you learned one thing tonight. Raise your hand if you learned one thing about your body that may impact your life going forward. Excellent. And if you didn't raise your hand, you can say thank you. Now drop it, please. We learned about the universal law of healing. We're here to tell you, and this is what we're serious about, everyone in this room is entitled to a checkup. And your family. Now, I didn't say you need care. I don't know that you need care. But you're entitled to a checkup. How many of you have been to a doctor in the past year? Raise your hand. Did your doctor, he or she, check the function of your nervous system? It only controls everything in your body. They looked at my blood. They didn't look at the nervous system. In our office, our checkup is probably the most thorough evaluation that you'll ever go through. Our patients can probably nod their heads to that. We spend about 45 to 60 minutes with you the first time we meet you. We go through your health history. We do a thorough orthopedic, neurological, and chiropractic evaluation. We do computerized testing on your nervous system to see if and where there's any interference. And we take the special upper cervical x-rays only if they're indicated.